Welcome to Evergreen Family Medicine. Today we are with Cece Lynn. She's a community health worker, or CHW, and doula here at Evergreen. Welcome in.
Thank you for having me.
People hear sometimes that CHW term, so what is a community health worker here at Evergreen?
So a community health worker is a resource coordinator, and we find the social determinants of health and direct people to where in the community they can find answers or get the resource they need.
Which is great because it starts with a physical checkup maybe, or a reason to come to the doctor, and then there are some other things that play into your total health.
Of course. So they come in for their appointments, and the doctor is taking care of their medical need, and CHWs come in and we take care of their social needs.
Very nice. Okay, well, we want to talk about a doula here at Evergreen Family Medicine, another term people may or may not be totally familiar with. So first of all, describe what a doula is and maybe a little bit about the training that it's required.
Yeah, so a doula is a labor and delivery support person, and doulas assist patients and clients through all stages of labor. We are non-clinical staff, so we are focused more on the birther and helping them through pain management, getting them into different position changing, and also we can do massage, pressure points, and also just cheerleading, coaching them through the process, verbal affirmation, and being present.
How is a doula different than, say, a midwife?
So midwives are considered clinical, whereas doulas are non-medical staff. So we are there for the client. We do not touch medications, do vitals. We do not do any of that. We are solely there for the birthing person.
So talk a little bit about your training to become a doula.
So me specifically, I had done a 3-day training, and it was with a group of people led by a doula that had been a doula for years and years. She's in the Portland area, and I was with this group of people, and we just practiced on each other. We did massage and pressure points, and really just kind of found that distinction of a doula's role and their scope of practice versus clinical staff or nurses or midwives, because we are kind of cheerleaders and advocates and there to support, whether that's, physical support or emotional support. It is a wide range, but it was great information, and just being able to have that tool in your tool belt to assist people in this next journey of their life is amazing.
So sometimes the term doula ends up being connected to home births.
Yes.
But in this case, it's offered by Evergreen. So what is the difference, or what does it look like for the doula experience for a patient at Evergreen when it's happening at Evergreen?
Yeah, so I meet with patients at their OB appointments and introduce myself and offer services. And me being a doula here at Evergreen really just shows the innovative ways where we've tried to offer collaborative care, where I work alongside our OBs and our midwives. And because our OBs and midwives do not do home deliveries, I in turn do not do home deliveries. I work in collaboration with them as like an extension of their services. It's pretty neat though, because you still are involved in that part of their journey and their experience, but I mainly just do deliveries there at the hospital.
So does a person have to request a doula? Are you part of the entire process, or how does it work out where you wind up as part of the team?
So people sometimes mention in their OB appointments that they are interested in having a doula, and I am up here in women's health, and so oftentimes they hand off the patient to me, and we just talk about what a doula is, what's in a doula's scope of practice, how it benefits the patient even. And then we just kind of touch base and see if I'm a good fit for them. Or I meet with people regularly through our prenatal classes and through our baby beginnings program, and that is another way where they can get in touch with me for doula services.
Well, Cece, thank you very much for your time and for the look into life as a doula.
Thank you.
All right, you can find out more about all the providers here at Evergreen Family Medicine at evergreenfamilymedicine.com, and follow Evergreen online on our channels in YouTube, Facebook, Instagram, and Twitter.